Hey everyone, welcome back to the FU Cancer podcast. Today we're tackling a challenge that so many cancer patients face, eating when you have no appetite. Whether it's from treatment side effects, stress, or just feeling off, getting enough nutrition can sometimes feel like an uphill battle. Joining me in this episode is Elizabeth Miracle, a registered dietitian nutritionist, certified nutrition support clinician, and board certified specialist in oncology nutrition. Elizabeth is a paid content creator for fucancer.health and earned her Bachelor of Science degree in dietetics from the University of Wisconsin-Madison, followed by a master's in human nutrition from the University of Alabama. With over 10 years of experience, Elizabeth has worked with cancer patients throughout treatment and recovery. She is currently a senior clinical nutritionist at New York Presbyterian Columbia University Irving Medical Center, where she helps surgical oncology patients and those needing nutrition support like tube feeding or IV nutrition. Elizabeth is passionate about providing personalized nutrition guidance to cancer patients and their families, helping them stay nourished and improve quality of life during and after cancer treatment. Thanks for listening to the FU Cancer podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. Well, Elizabeth, welcome. Thank you so much for joining us on the FU Cancer podcast.
Happy to be here.
So I wanted to start with the why. Why do so many cancer patients struggle with their appetite in particular?
So I think many patients struggle with their appetite during cancer treatment for a variety of reasons, and it's more than them just not feeling hungry. The cancer itself, along with the body's response to cancer, can disrupt how appetite's regulated. And at the same time, patients are also experiencing what we like to call nutrition impact symptoms that really affect how they're eating and also their confidence in eating. So this could include things like nausea, vomiting, dry mouth, taste changes, fatigue, and it's usually really challenging for patients to kind of overcome these to get enough nutrition. And then there's also, in some cases, patients may actually have tumors or their cancer may be physically blocking parts of their body or their digestive tract, which really also impacts their ability to eat. There's also a psychological factor such as depression, anxiety that can also impact patients. So there's a lot of different buckets where patients can have their appetite be affected during treatment.
So if somebody's struggling to eat, what are your top recommendations?
When someone's struggling to eat, we really want to focus on getting enough nutrition and really making the most out of each bite and understanding, what nutrition impact symptoms patients are having can really help us cater nutrition care to them and personalize it to give them a little bit more recommendations for what will work for them or might not work based on the symptoms they're experiencing. So we really want to focus on nutrient dense foods that add calories or protein to diets. If there's a specific food item that's really working for a patient, I usually encourage patients to kind of lean into it and embrace it and also look for ways to add more nutrition to it. So depending on the food, this could include adding like a drizzle of olive oil on top of it or avocado oil when you're finishing the dish, adding a dollop of sour cream or Greek yogurt, a handful of cheese, chopped nuts, seeds, just to add calories and kind of also add nutrition density to the food while keeping, what the original intent is, which is the food that's working with them. We also can really encourage patients to consume smaller, more frequent meals. And the sum of all those really tiny meals during the day can help patients meet their individual nutrition goals in a way that might feel easier, a little bit more digestible based on the symptoms they're having, and also a little bit less overwhelming. Sometimes having, a big plate of food in front of you 3 times a day is really overwhelming, especially when your appetite's not its best. We also like to recommend, kind of keeping things on hand that you can snack on, whether it's a hard-boiled egg, a cheese stick, tuna salad, egg salad, things in the front of the fridge that you can kind of grab and eat really quickly, just especially when you're not feeling good. I also do like to encourage if you're able to tolerate full-fat dairy products, and then using any oral nutrition supplements or shakes. This could be pre-made Or if you want to make something at home, you have a little bit more control over the ingredients. Protein bars, again, or something, a granola bar that you can grab is really easy as well. Aside from practical advice, my number one thing that I do usually share with patients who are struggling is that nutrition really doesn't need to be super complicated. It doesn't really need to be fancy. It just needs to taste good to you. And what tastes good to you may change throughout the course of treatment, and that's totally okay.
Well, you've mentioned a couple of times some protein-rich foods, like the cheese sticks, for example. And we know that protein is crucial for healing and for building and maintaining one's strength. But I think it can be tough sometimes when you're not eating that much in general. So, do you have any tips for increasing protein intake in particular?
So we want to make sure we're focusing on our main protein sources, and that can be different from patient to patient because everybody has their own unique preferences on what they like to eat, cultural, religious preferences as well. So we do also want to kind of look what works for you and what protein sources do you normally gravitate towards. And also, are we having any issues tolerating those right now? A lot of patients do develop taste aversions that could make it difficult to meet protein goals or even to eat things that normally are go-tos or favorite foods. If you're somebody who focuses on more animal-based proteins and you're struggling with those, we want to try and incorporate more plant-based foods. And this could look like adding or even complementary foods that make complete protein sources, things like lentils, beans, quinoa, tofu, nuts and seeds, again, kind of sprinkling those foods or incorporating them into foods that we already like to improve the nutrition density. Combining foods like peanut butter and bread or rice and beans, chia seeds, oatmeal, hummus and pita, those all make complementary complete protein sources without having that, animal protein that you might be avoiding right now or that's not really working for you. If you are focusing on animal proteins and those are still a big part of your diet, you can try different marinade sauces. Making new dishes can help see the food in a different way. Just even also mix up the flavor a little bit, changing the form, shredding chicken, using ground beef, incorporating those into more mixed dishes where it's not necessarily the focus of the dish, but it's incorporated throughout is a good way to, get a little bit more protein in without that turn off of a big piece of protein on your plate.
Well, and sometimes I think it's not about making the right food choices, but just sitting down to eat at all, right? Like just eating something can be hard certain days. So do you have any practical strategies, for our listeners who may be in that camp?
I think it's really challenging when you're not feeling your best, you're fatigued, or you're in pain. So it's also really stressful when you don't want to eat, and we have a lot of pressure to eat during treatment, and as viewing eating as part of our cancer treatments. So focusing on those small, frequent meals, consuming 4 to 6 small meals during the day, and also giving yourself permission to snack during the day can help you get a little bit more. You can also try and make meal times a little bit more social and eating with friends or family
Mhm.
around, both as encouragement, but also, you know, as sometimes patients do feel like they eat a little bit more if somebody's there.
Mhm.
We also want to try and really listen to your body and kind of pay attention to when you're feeling most hungry and trying to eat as much as you can during those times. If it's breakfast, maybe you have a really big breakfast and you kind of snack a little bit more throughout the day, but you got a lot in during that one meal.
Mhm.
And if you're able to engage in light physical activity, it can be social, but it also can help stimulate your appetite.
Great. Well, before we wrap up, do you have just one final piece of advice you'd like to share?
I think we do have a lot of supportive people in our lives that are really engaged in our cancer care, and they're also doing their best to help with suggestions, sharing opinions, experiences, or any research, which I think can be really overwhelming for patients as everyone's kind of navigating treatment. And there's also a lot of talk about nutrition that patients hear in terms of absolutes. You should eat this, you shouldn't eat this, this is good for you, this is not good for you, which also can kind of muddy everything.
Mhm.
I do encourage patients to remember that, they're unique. So is their cancer journey and what's healthy and what's appropriate for them right now based on their experiences, and their cancer care is not the same as someone else. They don't share the same health history, medical history, finances, or even home environment. So as I mentioned earlier, nutrition doesn't really need to be fancy. It doesn't need to be perfect. It doesn't need to be complicated, especially when you're not feeling your best. It just needs to taste good to you. And it
Mhm.
needs to be something that you like to eat. So always just remember to kind of be kind to yourself. Focus on what's, feels right to you. Nourishing is enjoyable, and it's okay to tune out the noise and just do you sometimes.
Well, Elizabeth, thank you so much for joining us today and for sharing your expertise. A lot of great tips, so thank you so much.
Thank you so much.
Well, and listeners, if you or someone you love is struggling with nutrition during cancer treatment, encourage you to visit our website at fucancer.health. Elizabeth is actually one of our content creators, so she's got some great information available for our members, and we'd love to share it with you. And as always, be sure to like and follow us wherever you listen to your favorite podcasts. Until next time, I'm Christina Rollins. Thanks for listening.